if all the testing is negative, you can't necessarily 100% rule that out, because if mom were treated, and we have study after study showing that, case studies, that moms who were treated still translated those infections to their child, even if they tested negative. And that's what we see. So it's never 100%. It's neither an either or. You have to be vigilant.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Welcome back to Demystifying PANS PANDAS. I'm Dr. Nancy O'Hara, and I'm really excited to welcome Dr. Summer DelSignore. Summer is a board-certified child and adolescent international provider, and she's really known for her expertise in the diagnosis and management of complex chronic illnesses in children. She's developed the RESET protocol, which we'll talk about, using a root cause lens to treat immune dysfunction systematically. And in addition to being a fellow at MAPS and AAOT and a member of ILADS, her expertise in autoimmune, neuroimmunity, psychiatric manifestations of infectious diseases, particularly tick-borne diseases, is incredible. She has a master's in nursing practice from the University of Pennsylvania, a doctorate in nursing practice from SUNY Upstate Medical University, graduating magna and summa cum laude, and she's completed residencies at CHOP, Penn State, Children's Health in Dallas. I could go on and on. Summer is near to me in Beacon, New York, and she's the CEO and founder of Hudson Valley Integrative Health. So, Summer, thank you so much for joining me.
Thank you for having me, Nancy. Happy to be here.
I've really enjoyed many of your talks, as well as a lot of the interaction that I've seen you have on ILADS about congenital vector-borne infections. And I think that's an area that is really misunderstood and not talked about enough, whether it be in autism, autoimmune encephalopathy, other neurodevelopmental conditions. And I really appreciate and respect your opinions in all of that.
Well, thank you.
So for parents or practitioners that are listening and new to the topic, what are these congenital vector-borne infections and how do they affect the baby's developing brain and immune system?
So a vector-borne disease is essentially transmitted by another organism. So the vector, so it could be a mosquito, flea, sandflies, ticks, things like that. In the news, you kind of hear about like West Nile virus when there's outbreaks of those, or Zika virus, where that's very common. But what's less common are things like Borrelia, which is the culprit for Lyme disease, Bartonella, Babesia, and other not as well-known vectors that can contribute to neuroinflammatory and developmental issues with the kids. And so that's how we view that. So that's that general overview of that vector-borne. And that's typically mom is affected by it, and somehow, either through the cord blood or through the placenta, the baby can be affected.
Yeah. And we're not talking about opinion. We're talking about science.
Science, fact.
Yeah. I mean, so what does science tell us about how these infections during pregnancy influence that development or communication or whatever it is?
Right. And it's interesting with the studies. It is really dependent upon stage of pregnancy. We know that there are certain components of that brain and neurological system and immune system that are developing at the time. So it will affect things like neural stem cells. It can certainly trigger early cell death and disrupt cell division, and certainly early in that phase 1. And that can reduce brain growth and cause some really significant abnormal cortical development and structural brain malformalities. And many times those moms are having spontaneous abortions, miscarriages very, very early on and not even knowing why. And many times it can be from those infections that are passed very, very early on. Later on, you see that when you've got more of the basic brain development out of the way and you're moving into more of like a second trimester, third, it's infecting and interfering with sort of neuronal migration and synapses formation and myelination. So, those next level things of that brain wiring is then affected and can create some dysfunction as a result of it. And then you end up with certain regions of the brain that are most affected, like motor control and language and social communication and attention, all of those things that sometimes are then misdiagnosed later as a, neurodevelopmental or what have you, when we want to look at it from more of an infectious trigger route.
Right. And we also both talk a lot about neuroinflammation, autoimmune, encephalitis, and all of that. So explain a little bit more, because I know you can do it in such simple terms, about how that activation of the immune system affects the child's brain.
Right. So, inflammatory cytokines, that's what
Yep.
mom is going to produce a great deal of if she's exposed. And we talk about the infectious component that could be transmitted to the baby, but also the immune response the mom has. Even if we don't transmit an infection, that inflammation can still trigger more activation of immune cells in that developing brain. The
Yeah.
microglia, right? And when those are turned on, they get super hyper, and sometimes they don't know how to stop. They don't know how to turn off. And what's interesting in a fetal brain versus someone who is thriving outside of the womb is that it's developing and the microglia are affecting certain neurons that are developing
Yeah.
and synaptic pruning and circuits, and it's really affecting that. So when that child's born, we see this alternative pathway that continues on because it's been retrained or reprogrammed from that perspective. So it's a complete disruptor.
Yeah.
Yeah,
Yeah.
absolutely.
And I've heard you talk about, for instance, Dr. Brian Fallon's research and how, myelination, how the myelin sheaths, the nerves, can be
Mhm.
affected by Borrelia, how the endothelial cells can be affected by Bartonella, how the red blood cells can be affected by Babesia and decrease oxidation. So all of
Right.
those three Bs in lots of different ways.
Correct. Absolutely. And, if you think about it, they may easily be transmitted. We don't do human studies because it's unethical. We can't do that. But you see it in animal studies, and you see it in a lot of postmortem studies and case studies with
Yeah.
the stillbirths and early miscarriages that happen. And the migration process, if you look at the science, again, not opinion, science, it's very easy to transmit something across that placenta. It's very rich in capillary and blood network, especially things like Bartonella and Borrelia that can burrow through. They just
Yeah.
have to hitch a ride and burrow through those cells and they make their way in. Things like Babesia, which is a cousin to malaria,
Yeah.
hijacks a red blood cell right through the cord blood and goes right in. So it's very easy for that to
Yeah.
translate over to that baby.
Yeah. And you mentioned briefly the timing.
Yes.
Why is the timing of an infection during pregnancy or even early infancy, why does that matter so much?
It has a lot to do with vulnerability.
Yeah.
So I think that early pregnancy, there are some thoughts that, or generally there's thoughts that the placenta is just going to protect the baby no matter what, that it's a fortress. And to a degree, yes, it is. But early in pregnancy, first trimester, it's still growing. It's still very vulnerable. And so you don't have that fortification. And the mom is naturally in a very inflammatory state on purpose. That's how
Yeah.
nature intended to promote that growth and development. So sometimes inflammation is good. And so that's the normal state. So this is where those bugs can hijack and take advantage of that situation to say, I have epithelial cells and a fortress that isn't quite fortified. I can wiggle through there. There's inflammation, so my immune system's already distracted, so I should be able to pass through. Then you move to something more like a second trimester and early third. you're pretty fortified at that point. That's the feeding, growing anti-inflammatory stage where you would have less risk, not no risk, but less risk of transmitting something. And then late in third trimester, you're at risk again. It kicks up with the inflammation because now you're looking to push that baby out, bird those things and get rid of it. So again, you've got to not response, right? It can't stay in there forever. So that's kind of how you have to look at it. So if you just look at it from a what phase of pregnancy are we in? When was mom exposed? And then at what developmental stage are we with that child? And again, we know most of those organs are developing first trimester. So that's not only going to affect the way that they develop, but the way they function later, if they even make it later, depending upon how severe that infection could be.
Right.
Yeah.
And then thinking about early infancy,
Mhm.
we both agree and science shows that it can get transmitted through breastfeeding. But I
Yes.
think we both also agree that the benefits of breastfeeding may well, outweigh the pathogenic. Can you comment on that a little bit?
I can, absolutely. There's so much benefit to breast milk and babies, and we know that, and there's so many immune benefits. My thought is that if we're worried about transmitting something through breast milk, there's a good chance that child's already had exposure in utero.
Yep.
And at this point, let's just get the nourishment that we can from that breast milk, and we're going to ultimately end up treating that child anyway.
Right.
The fewer foreign things or formulas, which we know in the news lately haven't necessarily been the best. And they find a lot of things in it that aren't necessarily optimal for
Yeah.
healthy growth. But I do feel that it's still best to push through and breastfeed. I think that if a mother needs treatment, that we have to be mindful of that, knowing that whatever we're giving her to treat is going to translate. There's some caveats to that, but otherwise it's better. It's better to
Yeah.
breastfeed. I would never
Yeah.
discourage a mom.
Yeah,
Yeah.
I agree. I agree. Now, you talked about pregnancy loss possibly being a sign of the
Yes.
mom having vector-borne diseases, but in the children, and I'm sure the patterns and symptoms could take you an hour to talk about all of them, but what are some of the patterns and symptoms in children that you may see that might make a parent or practitioner think about vector-borne diseases in pregnancy?
Right, which is interesting. When children present, they're very different than an adult. So where adults will say, I have, day sweats, night sweats, fatigue, migratory joint pain, I may have rashes, not necessarily bullseye, but just weird rashes all over. I have neuropathy, so that numbness and tingling. Kids don't necessarily present that way, or they don't know that they do. But what moms and dads would observe is more neurological and behavioral in nature. And we see that quite a bit. So, from a behavioral standpoint, it may be as soft a sign as, well, they're not quite missing milestones, but they're very sluggish. And their social interactions aren't that great, but they're still kind of on par. And those are the kids that kind of get missed, and it takes a while to figure it out. And then, motor skills can be delayed. Find that stamina is a big one. Not necessarily chronic fatigue that they're sleeping all day, but kids will push themselves, and you'll see stamina. They can't keep up with their peers. They may be, from a motor skill perspective, a little kind of floppy, as I call it, so that their tone's just not great. They're poor feeders. They're poor sleepers. They have, some reflux here and there beyond
Yeah.
what you would see with the normal, and just inconsolable. I find a lot of irritability
Yeah.
with those babies, which can translate later to things like anxiety and OCD. And who knows, they could be hallucinating as far as we know as a baby. They can't verbalize it yet, but it's really that more of that, neuropsych kind of presentation versus the traditional.
Right, right. And this can happen if the child themselves gets exposed to a vector. But what you're saying is that these symptoms can happen when they're exposed to it in the placenta, in the womb.
Exactly.
And we need to think about that whenever we're seeing these symptoms too. Anytime you're thinking about a torch workup, for example, or any type of infectious workup, we should be thinking about these congenital vector-borne illnesses, right?
We should. And you know as well as I do with classic torch, it's not in the first panels. It's
Yeah.
not there. It's maybe, the tertiary panels afterwards, after we've worked through. And most of those initial ones are more STD related and certainly viral. But we don't get to tick-borne until later, if at all. It just depends
Right.
upon that practitioner and if they're well aware of it and they have that discerning eye and they know that that is something that should be considered.
Yeah.
And I would love to see that sort of in the forefront in that first panel.
Yeah. Yeah. And then signs, I've heard you talk about, for instance, smaller head size, calcifications, and maybe even failure to thrive,
Correct.
jaundice that's out of, those can also be signs.
Correct. It absolutely can be signs. Yes, absolutely. And then, from a laboratory perspective, any child who presents with anemia beyond certainly should be evaluated as well. So,
Yeah.
absolutely.
Okay. And recently, in a discussion in ILADS, the International Lyme and Associated Disease Society, you were very eloquently talking about testing the placenta. Talk a little bit about what you need to look at in that if a mom is concerned, because I think some of your points were ones that people may not even think about. We are all unique. So why should your health care be one size fits all? At Hopewell Pharmacy and Compounding Center, they specialize in integrative health, bridging the gap between conventional medicine and holistic wellness. Whether you're looking for professional-grade supplements, customized hormone replacement, their expert team treats the whole person, not just the symptoms. They are a leader in specialized therapies, including high-concentration methylcobalamin shots designed to support neurologic health and energy at the cellular level. And you don't have to be local to experience their expertise. Hopewell is licensed in 34 states and Washington, D.C., delivering personalized wellness right to your door. Hopewell is a family-owned pharmacy which has been in existence since 1987. You can call them at 800-792-6670. Email them at info@hopewellrx.com or visit them online at www.hopewellrx.com. HOPEWELL Pharmacy, your partner in integrative wellness.
Right. So sending the cord blood and the placenta samples for testing is important. And you're looking for PCR data, you're looking for the DNA of that spirochete or those other infections in there. That's step one. And understanding it's not 100% foolproof, but it is a good indicator. And then you're looking at the health of that placenta. If there's inclusions, if there are vascular abnormalities, things like that could indicate that there's a lot of inflammation that occurred at the time. And that can certainly translate into that intrauterine environment and that interplacental environment for that baby. To know that what that environment may have looked like from an inflammatory perspective, you can also look at some of those inflammatory markers and some of those cord bloods and that placenta. Absolutely. And that needs to be that first step. What I would say as a cautionary component is that if all the testing is negative, you can't necessarily 100% rule that out.
Yeah.
Because if mom were treated, and we have study after study showing that case studies that moms who were treated still translated those infections to their child, even if they tested negative. And
Right.
that's what we see. So it's never 100%. It's neither an either or. You have to be vigilant when there is an exposure. And I would even back it up further to say that's when, as clinicians, we have to be excellent history takers and we have to really do a really great history physical on that mom and determine her risk that way. And then try to back it up with the laboratory testing and the data. But that would be our indicator to watch that child even after birth. So even if everything looks clean,
Yep.
still watch them.
Yeah. Yeah. Because as you said, transmission can occur even with treated moms, where the
Okay.
pathogen low is really low, but the infection still passes.
Right. Again, if you think of things like babesia, if it's hanging out inside of that red blood cell and it's not in a high load in the body and the mom is not in a parasitemia state, she's not going to necessarily show you from an immune perspective, but it's freely riding across that cord blood, feeding that baby, and it's there. And same with those other bugs. And you know this just as well as I do, that there are many subclinical cases, and there are many that we see that have every symptom under the sun, and those labs are still negative, and they won't pop
Yeah.
positive until you have their immune system back online and
Right.
treated. So,
Right. You know,
yeah,
and there are so many reasons for that in children. I mean, they may have immunodeficiency
correct.
developmentally. They may have immunodeficiency from other infections.
Right.
They may not be able to mount that immune response. Or they
Correct.
may have, the inflammation, neuroinflammation that you were previously talking about.
Correct.
So it's a very, as we both know, very complicated and but important thing to think about, talk about, and test for.
Mhm.
Um, and none of this in this podcast or our discussion today is about medical treatment. But in your opinion, should moms be treated during pregnancy? You know or suspect there's an infection in mom. How do you handle that?
I treat. So we're trying to optimize the best outcome for both
Yeah,
mom and baby. And I think that if we can reduce that potential vector-borne burden, that we give that developing child the best chance at life. And the risks of not treating outweigh, so I certainly would treat for all of those. And again, we have to look at, risk benefit for every medication,
yeah,
to ensure that we're not going to add any additional burden or harm, but we have to do something. And there are a handful of meds, and and we've had these discussions online and outside, that there are some practitioners who are very nervous at doing it and who can be locked into certain types of treatment and meds that may or may not be beneficial. So my take is that if we're going to treat, let's fully treat the most effective way that we can. That's the safest way for that child. And, you have to ask yourself the question, are we safer allowing something like Borrelia or Babesia to pass to that child, knowing that there's about a 30% chance of spontaneous abortion with a Babesia infected baby on top of other things versus treating and maybe having potential side effect or none at all for
yeah.
treatment. So you kind of have to lay it out that way.
Yeah. And also, I think we both are respectful of the parents' decision because there may well be parents that are like,
Yes.
I don't want to treat this while I'm pregnant. And
Uh-huh.
and then you would go on to say, okay, then we have to be conscious of how we treat the baby or the child, right?
Right. And I have had some of those cases and they didn't want to treat. They were otherwise healthy moms who wanted to wait until the child was born to treat and said, I'm happy to treat the baby when they're born, but I don't want to risk it right now. Despite having the evidence, it's still a parent's decision. And so you have to be there to guide them. So then the way that I flip that from a treatment perspective is to say, well, let me see what I can do to optimize your immune system and keep the inflammation down. What can we do from that perspective? And then we'll keep you closely monitored. Any changes you follow up, we'll work with you and your OB, but we'll just flip it to optimize inflammatory components or immune components to still optimize the environment for that baby to continue to
Yeah.
grow.
Yeah. And then the
Yeah.
baby is born. Baby comes
Yes.
out looking wonderful. There's no failure to thrive. There's no jaundice. There's no problems. But
Yes.
as you and I both know, a lot of these clinical symptoms may be very delayed. The
Correct.
baby may be infected or impacted, but their symptoms are delayed by months, by
Right.
years.
Correct. Correct. Absolutely. And again, with newborns, they're carrying mom's immunity in the beginning, right?
Yeah.
So they're relying on mom. They're not relying on their own. And you start to see it when there are additional insults. And insults can be other infections. It can be toxins to include, mold, some of the elements that we find in vaccines, heavy metals, other things that could trigger kind of an immune response. And that's when you start
Yeah.
to see the immune dysfunction and then the rise and reactivation of something that's there.
Yeah. Yeah. And
Mhm.
and even in kids with pandas, for example, we'll see them, they'll have that strep infection and have that abrupt onset of neuropsychiatric symptoms, anxiety, OCD, tics, whatever it may be. But then you go and do the testing and you see that there's these vector-borne diseases, I think
Correct.
particularly Bartonella and Babesia in the background. And
Absolutely.
that needs to be treated before the child, both immunologically and neurologically, will be better, right?
Absolutely. And, it's more of a pet peeve of mine now. I don't like the term PANDAS anymore. I don't like PANS because I think it locks in to a certain type of infectious trigger when it could be broader from like more of an autoimmune encephalopathy or gangliosing, a an autoimmune kind of situation. And we know that it could be any infection really. And that when we find strep, and strep absolutely it is a thing, we know that. But when you are digging, like you said, you're finding other things. It's sort of
Yeah.
like strep is the proverbial straw.
Yeah.
You look back and you see all of these vector-borne things. You see other viruses that have been on board for a while and toxins. And then it's just sort of like when strep comes along, the immune system raises that white flag and says, Uncle, I can't do this anymore. I'm done. I surrender. I can't do it.
Yeah.
And then you have that response that happens afterwards with all of those symptoms.
Right. And I interviewed Sue Sweeto, the
Sure.
original researcher and grandmother of pandas. And I told Sue I wish she had named it the Sweeto disease to make it less controversial. But
Right?
she says she wishes she had kept the name autoimmune encephalitis of the basal ganglia associated with streptococcal infections. Not because
Right.
that's easier to say, but it
Right.
is really what's going on. But as you said, with all of these kids, it's autoimmune encephalitis, autoimmune encephalopathy, and where it hits the brain, may affect what symptoms you see.
Correct.
But, the PANS pandas are both kitschy and not
Right.
really accurate enough.
Correct. It's more of a syndrome, more of a collection of symptoms, just like we see with autism. It's a collection of symptoms that we make the educated guess and assumption that it's neurodevelopmental. But when you're looking at things biomedically, I like autoimmune encephalopathy better because there's a biomedical workup that you can do to
Yeah.
identify and treat it. So, absolutely. Yeah.
Yeah, and it's, parents get so discouraged because they may start out with strep as the
Yes.
trigger, and then they find out, well, there's mold and there's Bartonella and there's Babesia, and oh my God, my child is so much sicker.
Yeah.
But that's
Yes.
not it. It's the
Correct.
immune dysregulation, it's the immune activation caused by any trigger.
Right. And we have to drive that home because it takes
Yeah.
a lot of, there are a lot of social media wars between parents that we see about, well, no, you don't have PANS, you have PANDAS. And I'm looking and I'm thinking, it's all the same process.
Yeah.
It
Yeah.
really is. It's just the trigger's different or a different pathogen. And again, like you said, depending upon what component of the brain it affects will determine if it's more neuropsych or motor or both. It's really the overarching is the autoimmune component that's happening.
Yeah. Yeah. So I know your focus is on children, but of course you've
Mhm.
done tremendous work and research in this congenital infection realm. And from your perspective, I can hear moms saying, well, I've had Lyme disease and I want to get pregnant. I think it's gone. I think I've taken care of it. Or I have Lyme disease now and I'm coming to you to treat it. Is there an ideal time that you would wait after treating to get pregnant, or is there any resources or information about that?
I think that we certainly need to work on developing that,
Yeah.
and that should be a goal this year. But I think that treating and testing, certainly during family planning, and it shouldn't be within a couple of months. I have a lot of moms who will come to me, and I'm not an OB, but I work with them and their OB who say, I want IVF and I want this, and I'm doing it in 2 months, and treat me so that I can go get that done. The reality talk about things to say, well, one, you're at risk of not having a successful pregnancy, depending upon your age and when you're doing this, by about 50 to 80% just from the IVF.
Wow.
That's it. Let's add a tick-borne infection on there where the miscarriage rate is up to 30%. So then you're already, we're toast. So we have to have that talk, and we get the tears out and we get the hugs and we kind of come back to the table and we say, okay, now can we look at delaying this? So we have to really manage those expectations and understanding that treating is, you're looking at outliving the life cycle of an infection. So, at least 3 months if we kind of have a good sense of where it, many times much longer. I like to have serial testing, at least every 3 to 6 months for a couple of times, knowing that we've gone through several T cell washouts, as it's called. So with the antibody washouts about every 8 weeks, that you're doing that to say, okay, either the load is so low that it's undetectable or it's gone and we can't claim a rate because we just don't know. They're very stealthy bugs. So it's just really approaching that with caution and care and not necessarily discouraging a mom from wanting to start a family, but discussing those risks and then having a plan going into it. So I like to at least have a few serial negatives that appear to be negative and to keep that mom on some sort of preventative treatment. If there's certain herbals or certain medications we could do, whether they're getting pregnant assisted, with IVF or naturally, that we're supporting her, knowing that there is a potential that could still be there.
Right.
And then testing throughout.
Right. And I think the multiple testing is important. As I've talked to Ed Breitschwartz, who's a, international expert on Babesia and Bartonella, and really looked at the literature and everything else, a study that we're doing right now, we're finding one test, one moment in time may well miss these almost stealth infections. So
Exactly.
the triple draws or the multiple draws are so key to making
Mhm.
sure we're not missing it. And even then,
Mhm.
it's still
Well,
the clinical, the support of the system, right?
mhm. Absolutely. Absolutely.
Yeah. So, there are moms that have had tick-borne infections or vector-borne infections and have a totally neurodevelopmentally, neuropsychiatrically healthy child. What do we
Mhm.
know about the brain and the body's ability to heal or adapt when the immune or infectious stretchers?
Right. So that is that one word, neuroplasticity.
Yeah.
So that is the body's ability. We years ago, as we thought the brain was cooked. Once it developed, it didn't do anything, it was static. But now we know it's always molding. It's always rewiring circuitry as it needs to based upon any kind of inflammation or injury that's there. So we know that if we support that brain with the right nutrients to increase things like BDNF, which we know can help with neuroplasticity, the right type of healthy fats, which the brain's fatty, it's not a muscle, it's fatty.
Yeah.
They would want to give the right, the omegas and all of those really great things to support that. But the brain is a beautiful thing, not just in childhood, but lifelong, where it
Yeah.
can heal if you're giving the right nutrients and the right support. So
Yeah.
absolutely, it will
Yeah.
heal. And that's the question a lot of parents have is, oh my goodness, is my kid cooked or are they going to have this damage for the rest of their lives? And from an autoimmune encephalopathy perspective, we can comfortably say, well, no, we're going to work on it. We're going to help heal that.
Yeah, absolutely. So, to talk a little bit about practical steps that parents can take either before, during, or after pregnancy to support immune health, to support neurodevelopmental
Mhm.
issues.
Right. So before pregnancy, I think that it's important for those moms to optimize their own health, to ensure that they have evaluated with their practitioners any underlying infections they may have, and not just tick-borne, vector-borne, but all, viruses, anything that could contribute to inflammation. Look at their state of the state from an autoimmune perspective. Do they have markers related to a thyroid issue, or do they have, ANA markers that may be elevated, which we know don't necessarily mean an autoimmune disease, but can
Right.
trigger more autoimmune process or inflammation? And then looking at your diet, are you taking in goodness? Are you taking in junk that the body has to process and get rid of? So make sure that diet is nice and balanced, that you're getting optimal sleep to support your nervous system, which we could talk about autonomic nervous system for another hour too, and making sure that that's nice and balanced and getting optimal exercise. So all of that prep work that we all should be doing, no matter whether we want to
Right.
have babies or not, we should all be doing that. And then during those pregnancy states, still optimizing nutrition, keeping inflammation down, keeping the nervous system calm, trying not to stress, all of those things. So it's common sense type things. And then sort of post would be the nutrition of that baby. If you're going to breastfeed, you have to optimize your health, knowing whatever you take in, you're going to pass along. And then those healthy habits with those children later to say, fresh air and sunshine is wonderful, playtime, no screen time, healthy diets, be that anomaly where you're not giving them the processed food and the quick fixes, that we're taking the time. And I'm preaching what I kind of practice. I made my own baby food. I was a little neurotic about it with my kids. But it's types of things later. But really, looking at that, in avoiding those extra toxins that could trigger inflammation and affect that immune system.
Yeah, yeah. And as you're talking about the autonomic system, I'm also thinking, hearing parents in my head, oh my God, this is all too much. I'm already totally stressed out. I'm working 2 jobs. I have 3 kids already. How am I ever going to do this? And
Mhm.
and we both hear that and
Yes,
also want to say, take a breath.
exactly.
You do what you can do as much as possible because your stress also affects your developing baby, your child, your whole family's stress. So we want to honor that and hold you in the light also.
Absolutely, absolutely. And it's doing your best because you're going to
Yeah,
stress about not being able to do your best, which is going to
exactly.
compound the situation. So I talk to the parents and say, okay, where can we carve out 10, 15 minutes a day? We can do this. Maybe
Yeah,
it's not scrolling on your phone, not watching television, maybe doing some deep breathing. Maybe if the kids are getting a little crazy, if you have others, say, let's all go outside and take a walk if it's a nice day. Like
yeah,
little things, having really kind of downtime at dinner just to discuss things, whatever that may be. It can just be
right,
carved out minutes here and there. It doesn't
right.
have to be a spa day, so it can certainly be workable. And I think it could work for really any family situation to a degree.
Yeah. Yeah,
Mhm.
so true. And well, I want to spend a little bit of time talking about your reset protocol and tell me about it. Tell me about what it means and what you're doing with it.
So the reset protocol is essentially putting into words a framework that I use. And much like you being integrative, we're looking kind of soup to nuts,
Yeah.
every body system and understanding the interplay and interconnectedness of all that. And it was really to help patients to understand kind of what I was doing. When they would say, "Hey, do you have a protocol, for this?" I would say, "No, I have a framework and we'll kind of work
Yeah.
within it." So, reset stands for reducing inflammation, eliminating toxins, supporting gut health, eradicating infections, and then transforming health. And so, essentially, we're looking at each of those categories and going through that every time I evaluate a patient to say, if we have inflammation, well, what is the inflammation? And then what are the contributing factors? So, even those are all interplaying among each other. We're looking at gut health. Is there dysfunction there? Is there overgrowth of something? Are we not digesting properly? We do infectious disease panels to treat those. And then transforming health is more of a once we've kind of taken care of the bigger level things and we've got a better handle on it, even if we're not 100% out of the woods there, we're looking at ways to optimize health moving forward and then creating that plan to parlay this illness into more of a wellness plan later. And that's essentially the protocol, is taking those biomedical treatment steps and integrating things like nutrition and supporting emotional health and healthy habits generally speaking. So that's what that protocol is in a nutshell, is taking that framework and kind of, allowing creating something that patients can get their head around and understand the method to the madness and why we do what we do.
And is there some way coming out that people will be able to read more about this?
There is a lovely manuscript that we're in the editing phase and hopefully publishing at some point this year. And I will have that out. Absolutely. Absolutely.
That's amazing. And I think it's so important, when we talk about PANS and PANDAS in
Mm.
the conventional community, for those practitioners who really understand it and want to treat it, we still
Yeah.
often just hear about antibiotics,
Yes.
ibuprofen, steroids, IVIG,
Hmm.
and SSRIs maybe, or something to treat the symptoms. But
Right.
as you and I know, it's so much more than that. And
Is.
treating the immune system, the detoxification system, the gut, so important. And I think those are all the things you're getting at with this reset protocol, which is what you're doing every day in your office.
Right. Absolutely. Absolutely. So yeah, the focus with practitioners and those things you mentioned are not bad things. It's just part
Right.
of the solution, right? So when we're constantly in this sort of kill mode of trying to kill off this bacteria, this pathogen, if we're not considering how macrophages work and how clearance works and how the body can detox and considering genetics, how they can play the role uh, in helping that body maintain sort of a homeostasis as we're treating, we're not going to get anywhere. We're going to still
Yeah.
continue to sort of circulate this inflammation, and that inflammation it begets more immune dysfunction. So we have to add those other things in to say, okay, great. We have our nice treatment protocol here for an infection. And with that, you know as well as I do, we have some stealthy bugs that aren't going to necessarily respond to those antibiotics. And we have to learn how to outmaneuver that. So that's where herbals come into play. That's where things like biofilm busters come into play and fibronest busters to kind of break up the home or the hiding places where these bugs can and then really focusing heavily on detox to get the stuff out. And that's a big problem. And we know that there are certain genetic SNPs that contribute to poor detox in people. And we have to kind of nourish that as well. So you're right. We're not just going to get there with antibiotics and IVIG, which are great things, but we have to make sure that we're rounding out and creating that comprehensive treatment plan to get those kids to the finish line.
Yeah, yeah, and you mentioned herbals, you mentioned nutraceuticals, biofilm busters, all of that. I know you also use a lot of other immune modulating or anti-inflammatory interventions
Mhm.
before IVIG that may be very helpful. Do you want to mention about any of those too?
Absolutely, sure. So I utilize ozone therapy, so T and IV-PRP, which is true dose. And those all have the outcome is essentially the same, but a different mechanism for each of them. So we use ozone in the sense it's called MAH ozone, so major autohemotherapy, where we're utilizing your blood, we're pulling it out to a certain degree, a certain dose. We're hyperoxygenating it with the ozone and giving it back to you. So it's yours. It's not donor, it's your own blood. And it creates more of a enzymatic process that happens where it's helping us to rebalance the mitochondrial function. And if the mitochondrial is working well, then it can start to help detox things. It can clear up sort of cells that aren't functioning properly. And then that ozone can also help create something called ozonides, or I describe them to patients as like these biological bullets that can kind of punch through bacteria and viruses and things that don't belong. So it's a nice way of kind of having your cake and eating it too, and not worrying about having something donor given to you that we may need to deal with that you may have
Right.
a reaction to. Utilizing things like T therapy, which is more gene silencing therapy. And when you talk about gene silencing, that can be scary to parents until you explain it's not touching your child's genetics. It is solely focused upon a small genetic component of whatever bug we're programming it to go after, and it's sterilizing it so that it can't replicate. So then it dies off. So it doesn't need your immune system to respond. It doesn't need you to do anything but just allow the pathogens to show up. So we certainly use that, especially for those stealthier cases, things like Coxsackie and EBV, which we know are very difficult to get rid of. Even though we have medications for EBV, we don't really have anything for Coxsackie that's that effective. And then other stealthy vector-borne diseases, the Borrelia, the three Bs, Borrelia
Yeah.
Bartonella and Babesia. And then lastly, we have PRP. And I like to tease that in, not necessarily first, but there is sort of a preparatory phase that we go through to ensure that these things are effective. And I describe platelet therapy as a way of utilizing our own body's healing mechanisms, but taking the ADHD out of it. So when we're
Mhm.
sick, when we're inflamed, those platelets are sort of the conductors in the body, telling stem cells and growth factor and other cells where to go to heal or to clean up a mess. But if there's a lot going on, it can't do it. So
Yeah.
what we do is pull that blood out, concentrate it, and give it back to you. And
Yeah.
what's interesting is that it creates this reaction. So when you take blood out, the body says, I'm missing some blood. I need to make fresh platelets. So it'll start triggering out fresh platelets. Then when you consolidate that and centrifuge it down into a consolidated form, you're concentrating all of those extra platelets you just pulled out, the stem cells and growth factor, and you're injecting it back into that patient. And the body views it as something brand new. It doesn't view it as, I missed this. It's, oh, wow, you're giving me new goods to work with. And so that sort of creates this catalyst for healing. And that's sort of the preface behind that. Because patients have asked, well, if you're just taking my blood out and you're just spinning it and you're giving it back to me, well, what are we really doing? So there's science there. I know that's super, yeah, I know. But there is science behind it. And again, the body's a wonderful thing that can heal itself if you give it the right, you know.
Yeah, and clinically, I have seen so many of my own patients and others improve with the multiplicity of modalities that you
Right.
offer, but also what I really appreciate is both your understanding and communication of the science. Because this isn't voodoo.
No.
This isn't, I'll just, pull this out of my hat and charge this much money. And, there really is science behind why we need to treat the underlying trigger, infectious or
Mhm.
metabolic. We need to
Correct.
treat the immune system, and we need to treat the symptoms. But
Correct.
you're doing that in multiple different ways to
Mm.
really optimize the health of each patient that's coming to see you.
Absolutely. And you have to view it very comprehensively in that way and view these kids who are coming in with these conditions as their systems are all tapped out. We have to do it for them for a period of time until they're back online and can take over again. And that's the goal. And in more of a wellness focused model, unlike traditional models, and traditional has their place, absolutely, 100%. It's really just giving a med sometimes to band-aid things. So we're not looking for band-aids. We're looking for resolution. We're looking for replenishing the function that's
Yeah.
there.
Yeah. And
Absolutely.
and on that note, are these diseases, vector-borne diseases and others, in your opinion, treatable, recoverable in our kids and in our moms?
I do think so. I do think so. Recoverable, absolutely. Remission, absolutely. And I'm hoping, cure at some point. And we just need that linear data to show it. But I think that the technologies are advancing. And as practitioners, we're gaining traction there with the research. And I think it will come. But I
Yeah.
do see that we are recoverable, and these moms and these kids will live full, happy lives. And as I tell all of them, the more we dig with anybody, the more we're going to find.
Yeah.
Everyone has something going
Yep.
on. It's not a death sentence. It's not going to change your way of life or how you enjoy life. It's just something that has to be addressed. And we may have to approach things a little bit differently, but those kids and moms will still have their full lives and happy lives and make of it what they want.
Yeah. Absolutely. So before your manuscript is available or even after, how do people get in touch with you?
They can go to my main website, and that's at www.hudsonvalleyintegrativehealth.com, or they can follow me on Instagram at NYLimesandPans.
Yeah. And a great place to follow. Great account there too. And any last words of wisdom or hope or experience you want to leave families or practitioners with?
Right. So I like, there's a saying that, fear will always travel with you, no
Hmm.
matter what, from an infectious disease perspective and just from a life perspective, but you don't have to let it drive.
Hmm. I love
Yeah.
that. I love
Yeah.
that. I'm going to have to take that one with me too.
Yeah, absolutely.
Yeah, and you'll find Summer lecturing all over the place at MAPS, medmaps.org, at iLads. And as a practitioner, if you see her lecturing, please join us. And as a parent, there's a lot of hope and a lot of ways that both Dr. Summer DelSignore and others can treat our kids and our families. So, Summer, thank you so much for joining me today, and look forward to seeing you soon in the future.
Thank you, Nancy. Happy to be here.
And thanks, everybody, for joining Demystifying PANS. We'll see you next time. That's it for today's episode of Demystifying Pandas. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, Be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.